Hello, I'm Todd Didier, Senior Communications Manager at the Primary Care Collaborative. Every month, the PCC honors leaders who are helping improve the health of our nation by strengthening primary care. This month, we're thrilled to honor Kyna Fong, the co-founder and CEO of Elation Health, a platform for independent primary care that strengthens relationships between patients and physicians. Kyna, thank you for joining me today to discuss your work advancing primary care.
Thanks so much, Todd. It's an honor to be here.
Fantastic. Well, why don't you go ahead, tell us, how did you become a primary care champion, and why are you passionate about supporting access to high quality comprehensive primary care?
As a primary care physician, which is a great way to get to know primary care. I helped him, along with my older brother, set up a practice, build furniture, negotiate with insurance companies, and help support the back office of the practice. So that was an opportunity to really see the front lines of primary care, which I think really give a unique perspective to particularly the relationships. I mean, I would see, the same patients come in. I would see how much they trusted, that relationship with their doctor, my dad, and how much of an impact that made on them, really. And
Fantastic. So obviously you're very passionate about finding ways to support primary care because of your personal connection there. Could you tell us a little bit about how Elation Health works to improve both the provider and patient experience in primary care settings?
If you think about most legacy EHRs, they've been designed really around, billing and compliance. And so, and the clinical aspects have been really added on more as an afterthought, after these billing systems have been developed. And that's what we saw when we were looking for an EHR for my dad's practice, which is actually how we eventually ended up starting Elation. So Elation was really built to be what we call clinical first, which means it's designed around the clinical experience and the patient-physician relationship. And that is incredibly, as I spoke about, just incredibly important to deliver high quality, personalized primary care. And everything we do at Elation is really built to support the work of primary care.
As somebody who's kind of been exposed to the world of primary care for a while now, and who has seen it really in a clinical perspective, but also in a patient and a support role, I'm very curious, what do you see as the most pressing challenges facing primary care today? And how is Elation Health helping address those challenges?
If I were to think about first and foremost, I would say primary care, definitely struggles with just not really being paid well for the work that they do. And that has consequences, right? Like there is a well-documented growing primary care shortage that leads to many people in the US not having a primary care physician, despite how important that is. And then the increasing loss of sustainability of independent practice, where we know health outcomes and costs are better because the relationships, are strong and they're connected over time. And so, you can also add, if you talk about pressing challenges, primary care being overwhelmed by the amount of administrative burden that leads to burnout, physician burnout, which is also well documented. There's one thing to do a lot of work that feels productive, that feels like it's helping your patients live longer, healthier lives. But it's a totally different thing when it feels like you have a whole set of, administrivia that are repetitive tasks and documenting or checking off boxes. And unfortunately, a lot of that has fallen to primary care in our healthcare systems.
I'm curious, one of the things you mentioned is burnout, and burnout has obviously led to a lot of attrition, and the problem has only gotten worse over the past 4 years. We went through a pandemic. That combined with an already heavy workload and just a dwindling interest in primary care in general has led to us seeing workforce shortages across the country. And I know that Elation, that you, Kyna, pardon me, that you, Kyna, have been a strong voice for bolstering the primary care workforce. And I'm curious, what steps can policymakers and industry leaders take to strengthen the workforce? And why is it so critical we do?
Yeah, to your question of what can policymakers or industry leaders do, I think there are a few things come to mind. One is it really addressing that shortage head on and creating things like a student loan repayment program, right, to eliminate debt for graduating medical students who commit to spending a significant portion of time in a primary care specialty. Increasing scholarship programs that create a more diverse physician workforce, because there are plenty of studies that speak to the importance of a diverse PCP workforce to reflect the diverse societies and communities that we have. You could also talk about, increasing, like doubling the number of medical school slots and family medicine residency slots to really encourage the expansion of just the workforce, or folks who are committed to primary care. So there are a number of ways to do that, and obviously those things take time, and they take cohorts of medical students to graduate and be trained. But I think at the heart of it, we need to take those bold actions today, so that those shortages that exist today and are only being magnified over time start to recede.
Yeah, there's obviously a lot of work to do to bolster the workforce, and it sounds like you have some phenomenal ideas. If you could emphasize one major message to policymakers surrounding primary care, what would it be? So if you were able to go to Congress or go to the administration and tell them one aspect that you think they really need to hear, what would that message be?
One,
I know it's tough because we just laid out there's a lot.
there's a lot. There's a lot. Something I've seen be very successful there is just paying primary care prospectively to manage populations, right? As opposed to the sort of fee for service hamster wheel that so much of primary care has gotten stuck on, and in many cases unwillingly so. But that's just the system that they're in. And I think when you're able to pay primary care prospectively for a population of patients that they're managing, and that where they're accountable to the health outcomes and the overall costs of that population, it aligns what primary care is intended to do, and it also allows primary care physicians to keep their panel sizes manageable, to keep the volume of visits manageable, which also reflect burnout, but allow them to really deliver on the value that true primary care can bring. So
if you could wave a magic wand and you could change one thing about the American healthcare system overnight, what would it be?
one thing again.
Yes, right?
Right. Well, here's what I would say. Like the discrete every year, the AMA releases sort of the list of specialties. This is going along the primary care theme here, and like the list of specialties, highest to lowest paid. And every year, that's the moment for me that it just reinforces, when you see primary care as one of the bottom, paid specialties, it just reinforces all the work that needs to be done for primary care, all the things that we've been talking about. And so if I could wave a magic wand, make primary care one of the highest paid specialties instead of one of the lowest paid, because of course it's the highest valued, right? And so we can attract the top talent, we can address some of the workforce issues, and also just, bring the proper attention to this critical type of healthcare that's proven to generate tremendous, it's arguably the biggest return on investment in healthcare is an incremental dollar in primary care, saving $13 of downstream spend. So that would be, of course, that would be a reflection of really positive things happening for primary care of the sort we've been talking about today.
Absolutely. And I certainly would love to see that happen as well. I think that it would make a huge difference. So I think we at PCC are pretty well aligned on that with you. Well, thank you again so much for joining us. And we're thrilled to honor you as our primary care champion of the month. Thank you for all the work that you are doing to improve the quality of primary care for clinicians and patients across the country.
Thank you so much, Todd. It's been a pleasure to chat, and I'm very honored.